Right. So in Tequesta, people are relatively fortunate because they have pharmacies, urgent care, very close by. Jupiter Hospital is probably about 5 miles away. And they have a few doctor's offices here in town. I don't think it's enough, but they are relatively wealthier population. They're older, generally older, although there are some more families moving in. So they have good access to healthcare, maybe a little far for them if they don't drive. But I would say they're well served, in general. I would say so. A lot of retired executives come down here to live at the country club, play golf, spend their years swinging a golf club and enjoying the sun and things. So they understand, because their education level, they understand their healthcare status, their healthcare needs. They know to ask questions and are not hesitant to do that. We encourage it here. So that makes it easier to take, an easier patient to take care of, a patient that's involved in their care. So we like that. That I think is a big problem everywhere. Maybe not as much in Tequesta because people are still relatively wealthy, but the price of healthcare has gone up dramatically in the last few years. The insurance premiums, just what the patients tell me, has gone way up. Their co-pays and deductibles are a whole lot more than they have been in the last few years. They're only going up. The price of prescription drugs is, it's not uncommon for a generic drug to overnight rise in price 15 times. Overnight. Insurance pays for it, so people don't notice it. They just have their copay. They don't know the true price. The price is then passed on through their, monthly premiums, and so it's a real problem. Has to be addressed politically. Who knows what the outcome is, but that's not good. But I don't think it affects people in Tequesta as much as other areas. It's tougher for older people to travel. Even, the next town over is a longer distance for them than it is for me. So that would be nicer for Tequesta. But they have to drive everywhere or get someone to drive them. They're lucky, though, that they usually could do that. They are mostly older people retired here, so they have plenty of leisure time. They're pretty happy, which is nice. Makes it easy to have as a patient, a happy patient. They're, I would say, good about listening to their healthcare providers to take care of themselves. They want to do that, so that's good. They're proactive. It would be nice to see in this town. Maybe a few more doctors, maybe some public transportation. We were talking about Uber earlier. I don't think people know about that or can take advantage of what it can offer. Relatively cheap, on-the-spot transportation. That may help them. I think that might be something they could. I don't think they advertise Uber. Might be something to think about.